I welcome everybody and thank you so much for being here. I cannot believe it's already 49 people in the room with us. It really means this thing that we're about to discuss is something pressing, is something urgent, and is something we are tired to handle on our own. And we need a community. We need people that want to show up and people that want to work on it. So welcome, everyone. I will briefly guide you towards the program and towards what we're going to do today. So first of all, who am I? I'm Noemi, and I'm part of the Young Women's Health Group. I'm one of the board members of this amazing group, formed entirely by volunteers, and Martina and Peggy after me, that will explain to you a little bit better what we do and why we do it. What I can say just briefly is that we came together to discuss why Young Women's Health why young women's health should be a priority in the EU, and that's how then we decided that one of the first things we wanted to talk about was periods, was menstrual health, menstrual justice, and a dignified life for everybody that menstruates, not only a young woman's issue. Okay, now I will introduce you to the program, which is indeed, as I was saying, quite packed and quite interesting. At the beginning of this webinar, you will hear from Peggy Maguire, which is the director of the European Institute of Women's Health. She founded the Young Women's Health Group, so if we're here, it's because of the Institute efforts and the Institute realization that we have to represent every woman, and so even the most marginalized, and young women are the ones usually less heard and less understood. And then you will hear from Martina Alberani, which is the chair of this group, and that has been leading this work on the Menstrual Health Manifesto. And then Martina, she's a chronic health advocate, and she's also a member of Martina Rubino of the Young Women's Health Group, and she will guide you towards her lived experience and also some interesting and very, very juicy data. Then finally, the part why we're here today, which is why the manifesto matters and the manifesto itself. I don't have to speak too much about that because our advocates will guide you towards all the very thought and very hard worked paragraph that we have been writing for 1 year, because we started last year around this time, because it was indeed around Menstrual Health Day, Menstrual Hygiene Day. And then we have also external guests. So we have the deputy director of Règles Élémentaires, which is Justine Okoldok. I'm so sorry for pronouncing bad your names. As you can hear, my Italian accent won't leave even after 10 years of living abroad. And then we will have also the Irish Global Health Network that will briefly present their declaration for women's health. Perfect. I just want to mention the names of the amazing advocates that will take part today of the Young Women's Health Group. There is a lot of work behind the scenes, and a lot of, if you see these amazing graphics and if you see these amazing comms outreaches, because really everybody stepped in. So thank you so much, Evie, Grace, Lina, Benedetta, Anastasia, Martina, and Paola and Flavia for this work together. And I think now we can start. I give the floor to Peggy Maguire, Deputy Director of the European Institute of Women's Health, and our founder. Martina, maybe you have to give hosting power to Peggy.
She has just to unmute.
Perfect.
Okay, apologies. Thanks very much, Naomi and Martina. Good morning, everybody. And on behalf of the board of the European Institute of Women's Health, my colleague Heidi, who's online, and myself, thank you very much for the invitation to come here today. It's a pleasure to be here for the launch of the Young Women's Health Group Manifesto on Menstrual Health. It was actually a passionate presentation by Naomi Ritchie a couple of years ago on period poverty that really resonated with the Institute, and we really felt that we needed to support the establishment of a Young Women's Health Group. And really, it's an acknowledgement to the co-founders, Noemi Ritchie, Martina Albarani, and Flavia Chiavelli, whose research, advocacy, and leadership continue to advance menstrual health and young women's health well-being is so much needed. Their work demonstrates the power of evidence and lived experience in driving meaningful change, and long may it last. Also, congratulations to the extended membership that Noemi mentioned. The amount of hard work that's gone into this manifesto over the last year is immeasurable. But today is much more than periods. It's about health, and it's about dignity, equality, and opportunity. And menstrual health is a fundamental part of young women's health, yet for too long it has been overlooked and under-prioritised. The experiences of adolescents and young adults shape health, education, employment, and well-being moving into the future throughout their lives. Yet many young women still face barriers to accurate information, appropriate healthcare, menstrual products, and supportive environments. That is why this manifesto is so important. It recognises that menstrual health is not a niche issue. It is a public health issue, both at EU and national level. It's an education issue, an equality issue, and a human rights issue. And at its heart is a simple principle. There should be nothing about young women without young women. And young women must be active partners in shaping the policies and services that affect their lives. This manifesto reflects their voices and priorities and challenges all of us to place menstrual health firmly on the public policy agenda. And you know, the timing couldn't be more important as Europe shapes future priorities through initiatives such as the European Biotech Act and the next multi-annual financial framework. There's an opportunity to ensure that women's health, and particularly the health of young women, is recognised as a strategic priority for both research, innovation and investment. The manifesto is not simply a call for awareness, it's a call for action. Action to improve education, access to healthcare and menstrual products, research, and the meaningful involvement of young women like the women who are now involved in the Young Women's Health Group. They should be all involved in decision making. And as the Young Women's Health Group launched their manifesto today, I encourage everybody here to support and endorse it and help turn its recommendations into policy reality. Because when we invest in young women's health, we invest in healthier societies, greater equality, and a stronger future for all. It's my great pleasure to hand it over now to the to the Young Women's Health Group to tell us now all about this fantastic menstrual health manifesto. Thank you very much.
Yeah, thank you, Noemi and Peggy. Thank you so much. I'm very excited. And especially after these amazing introductions, honestly. So really, thank you, Peggy. Okay, so just a couple of words on our vision and mission. So as Naomi mentioned, the Young Women's Health Group was born from a shared conviction, which is that young women's voices belong in the rooms where health policy is made. We bring together a diverse network of young women from across Europe, so researchers, advocates, clinicians, students, all united by a common goal, which is to make young women's health a genuine political and public health priority. Another thing that we're really passionate about is that we're intersectional by design. We recognize that health is shaped by much more than biology, so by gender, age, race, socioeconomic background, disability, immigration status. And an approach that does not account for these overlapping identities will always fall short, in our opinion. And for us, there is no world in which this complexity is not valued and listened to. So our vision is straightforward, a world where every young woman has equal access to quality health care, representation in research, and opportunity to live a healthy, fulfilling life. And let me just say that being a woman is hard. Young women, older women, we all face challenges and hardships that we simply shouldn't face. While her work focuses for now on young women, we believe in womanhood or even more sisterhood, and we recognize and deeply respect the challenges that every woman face. And we hope to have the chance to collaborate in the future with women of all ages. But as young women, we live in two worlds, one in which for the first time we are really trying to make our voices heard. We're traveling, we're being economically independent, we have stopped prioritizing marriage, for example, and we are being asked to do it all and do it so like graciously without occupying too much space at the same time. But we also have to remember that there is also another word, one that still manifests the same inequalities as before, that still sees women as inferior. And I think that we are all familiar with the fact that this is seeing a renewed vigor recently. So young women now inherited old inequalities and also discovered new one as the world moves forward. And on top of that, we're frequently told that we should advocate for our own health, something that shouldn't even be framed as a right to fight for, but something that should be guaranteed simply with being a human being. And so with our group, we know that not every young woman has the means, the time, or even the will to advocate for her own health. So we really hope to stand strong enough together to give voice to them as well. And concretely, our work spans multiple areas, sexual and reproductive health, menstrual health, access to diagnosis and care, especially pain, which I'm especially passionate about, I have to say, mental health, neurodiversity, violence against women and young girls, and gender equity in research. So it's very important because these are not separate silos. They're deeply interconnected, and we try to approach them as such. So the Menstrual Health Manifesto we're launching today really exemplifies this. In it, you will find mention of diagnostic delays, underrepresentation in research, and the impact on mental health and the overall well-being of young women. But before we dive in, I would love to give the stage to Martina Rubino that will talk about another great value we strongly believe in, which is participatory approaches.
Thank you, Martina. Thank you, Noemi, and thank you, Peggy, for introducing. And good morning, everyone. And especially thank you so much to all of you for being here. Well, when we talk about menstrual health, we often, as we just mentioned, look at it through the lenses of statistics and policy briefs and legislative frameworks, which are, of course, incredibly important and vital for our work. But today I want to start by grounding us in the reality of what it actually means to live through these experiences. And for a long time, my relationship with my body was defined by pain and silence. And like other million women and people, I live with endometriosis and adenomyosis. And for years, I faced the classic and exhausting journey that many of us know very well, which is the dismissed symptoms, the being told that it's just a bad period or I have anxiety. And of course, I've been forced to navigate a very complex medical system that for years has dismissed my pain and took many, many years to get an accurate diagnosis. And living with a chronic menstrual condition means navigating a world that is not built for your reality. Because it means sitting in a university lecture or at your office desk while experiencing debilitating pain, and at the same time trying to look completely fine, because the alternative means explaining a condition that remains deeply stigmatized and ignored, and also not knowing if the other side will really understand what you're going through. And of course, this impacts your education, your career choices, your mental health, as well as your relationship, personally in the family, but also your affective ones and your friends, unfortunately. And for me, that pain eventually turned into a profound sense of injustice because I realized that the struggle that I was going through was not an isolated medical issue. It was not just personal, it was really political. And the reason that it takes an average of 7 to 10, 12 years to diagnose endometriosis is just not a clinical failure. It is really a systemic choice that stems from underfunding, under-researching, and overlooking women's health and pain. And that realization is exactly what drove me into advocacy, which led me to fight for menstrual equity and ultimately brought me here. And I'm very proud to stand here today as part of the Young Women's Health Group. So today we are presenting our manifesto. You will see, you heard also from Martina, this document is incredibly close to my heart because it bridges the gap between individual experience and institutional change. We aim to transform our collective lived experiences into concrete recommendations to EU policymakers. And throughout today's event, as you will see, we will dive deep into specific pillars that we developed in our manifesto. But we open this discussion, I ask you something, which is keep a human element at the very center of these discussions. We are not talking just about policy or legislative aspects. We are talking about dignity, health, future, but also the very present of million women and people across Europe. So thank you very much for this and have a good event, everyone.
Thank you, Martina. That was super powerful, and I'm really happy that we can speak about those things with this power and also so freely in this group. So now it's time to go to the manifesto. So Martina Alberani, back to you. Why this manifesto matters right now, and why would it matter even before? But
Yeah,
now
thank
it's time.
you very much, Noemi. And also, thank you, Martina. I think that we all agree that we can thank you enough for this speech, especially as a fellow chronically ill girly, chronically dismissed by healthcare professionals. Really, thank you. This is so important. But okay, so let's dive into the heart of the manifesto. As we said, the manifesto that we're launching today really exemplifies why everything is interconnected. So this manifesto was born by a very simple observation. Menstrual health is a fundamental part of the lives of young women and old people who menstruate. So menstruating is one of the most common and natural human experiences, literally. And yet it poses its own difficulties. And how extraordinary is that when you stop to think about it, that such a simple thing should be so challenging. And I can confidently say that each person who menstruates has faced some difficulties with their period. The stigma of smuggling a tampon up a sleeve, the exhaustion of making symptoms, and trying to meet the same expectations as always, the difficulties of affording period products, the dismissal of pain, the lack of access to safe and hygienic facilities, and more, as you will hear shortly. Yet, menstrual health has rarely been treated as a public health priority. Not enough data is collected, not enough research is funded, and too many people still manage their menstrual health without adequate information, support, or access to care. So we wanted to challenge that, and we wanted to do it by bringing evidence and young women voices into the policy conversation. So What we're proposing is not a radical shift. Noemi will walk you through our recommendations. It's a series of very practical, evidence-based steps that EU institutions, member states, organizations can take to make menstrual health more visible, better supported, and more equitably resourced. From improving data collection to investing in research. And these are all achievable goals. Many countries and associations are already moving in this direction, and we will hear more later from Ricky Elementaire. And so finally, where to find this manifesto? This manifesto is available for free on the European Institute for Women's Health website. You can also access it and endorse it through this QR link. So read it, share it, endorse it, and use it however it is most useful in your own context. This manifesto has really been a collective effort. It took a long time to see the light because we really wanted it to be born from participation. So please reach out, let's discuss this together. And now I am super happy to hand over to the incredible members of the Young Women's Health Group, who will take you through the manifesto section by section. They are the heart of this work, and I really hope you enjoy hearing from them as much as I always do. So let's start with Evie, with what is menstrual health?
Hello from me too. I'm really happy for being here. So let's dive into it. Menstrual health is complete physical, mental, and social well-being, and not just the absence of disease. And this is important to note because it is a fundamental human right. It is multidimensional, and according also to the World Health Organization, should be addressed even before it starts with menarche and until after it stops with menopause. And it is very important to note that this manifesto was written using the term people who menstruate because it was very important to keep it real and inclusive, and make it correspond to what actually happens in the world and not what we're used to calling it a women's issue only.
Okay, so next is Grace Ari, that will talk about the intersectional approach to menstruation that we used through this manifesto.
Hi, everyone. I'm so happy to be here and thank you for joining. It's important to note that menstruation is not experienced equally by all. Kimberly Crenshaw defines intersectionality as the interaction and cumulative effects of multiple forms of discrimination affecting the daily lives of individuals, and specifically for women of color. In the manifesto, we highlight 4 elements an intersectional lens is crucial for. Firstly, understanding how systems of power and discrimination on the basis of sex, race, class contribute to menstrual inequity. And second, identifying structural barriers. Based on 2024 data in the EU, 4 out of 10 people who menstruate experience a menstrual poverty with a lack of access to products, facilities, information, and dignity. And this unfortunately occurs with higher prevalence amongst low-income individuals, refugees, youth, and people with disabilities. Third is capturing diverse lived experiences. Nearly 34% of trans men and 24% of non-binary people live in period poverty, 2 times more than cis individuals. And finally, developing targeted interventions and inclusive policies. A crucial element of this manifesto is to highlight the importance of approaching menstruation with an intersectional lens and providing a framework to accurately understand menstrual inequity.
Thank you so much, Grace and Avi. Now, with Lena, we will discuss the negative impact of menstrual conditions.
Yes, thank you. I'm going to talk more about the negative impact of menstrual conditions that we talked about in this manifesto. And the key message we really want to convey here is that while menstruation itself is a normal bodily process, the experience of menstruation is not always harmless or even manageable. For people who menstruate, it comes with severe pain, heavy bleedings, fatigue, and emotional distress. And we want to make clear that these experiences are still too often minimized. Symptoms like these are frequently normalized as something people who menstruate should just simply tolerate, and related conditions such as endometriosis are still dismissed as just normal period pain. This everyday dismissal contributes to delays in recognizing symptoms as a problem. It keeps delays in diagnosis and delays in accessing appropriate care. We also want to show that the impact of menstrual symptoms goes far beyond physical discomfort. Menstrual health directly affects whether people who menstruate can participate fully in education, in work, or even in daily life with dignity. Stigma and silence make this burden heavier because many of us are expected to keep functioning as normal while we are hiding what we are really going through. And it's not a marginal issue. Research has actually shown that menstruation-related symptoms are linked to substantial productivity loss. There's a large study that estimated an average of around 8.9 days of productivity loss per person per year, mainly because people continue working or studying while they're feeling unwell rather than just staying at home. So the loss is more driven by presenteeism than by absence. So for me, the takeaway is really clear. Menstrual health cannot be treated as a private inconvenience or reduced to a narrow hygiene issue. It needs to be recognized as a public health, human rights, and equity issue. And that means taking menstrual symptoms seriously in research and clinical care, and creating schools, workplaces, and also healthcare systems that actually support people who menstruate instead of expecting them to suffer in silence. Thank you.
Thank you so much, Lena. And this is such an important topic and a closely related subject. Benedetta, can you talk about the under-researched and underfunded issue of women's health?
Good morning, everyone. Well, another important issue in menstrual health is the lack of research and funding dedicated to women's health more broadly. Despite the fact the menstrual cycle affects around half the population for a large part of their lives, many aspects of women's health remain surprisingly understudied. One example is the fact that medication and vaccines may have, depending on the phase of the menstrual cycle in which they are taken. We know that hormone levels fluctuate across the cycle and influence many physiological processes, including the immune system, yet this topic has received surprisingly little attention by researchers. A study by Cooper and colleagues published just a few days ago on Nature found that women vaccinated against COVID-19 during their follicular phase of their cycle were more likely to report vaccine side effects than those vaccinated during the luteal phase. While these findings need further confirmation, they highlight how much we still do not know about the interaction between menstrual health and medical treatments. But this also reflects a broader pattern. Research funding is often not aligned with the actual burden of disease. Conditions that disproportionately affect women, such as migraines, anxiety disorders, endometriosis, continue to receive less attention and investments than their impact on population health would justify. Endometriosis is perhaps the most striking example. It affects around 10% of people of reproductive age who menstruate worldwide, causing severe pain, fatigue, infertility, and a major impact on daily life, as said before, and mental health. Yet significant gaps remain in our understanding of its causes, diagnosis, and cure. But why does this all matter? Because research drives awareness, diagnosis, and treatment. When a condition is underfunded, we know less about it. And therefore, healthcare professionals receive less training, diagnostic pathways remain unclear, treatments develop more slowly, and patients often wait years before receiving answers. So understanding menstrual health, therefore, also requires us to ask one important question: whose health needs are being prioritized in research and whose are still being overlooked? Thank you.
Thank you so much, Benedetta. And speaking of research, Anastasia, can you tell us more about research on menstrual health?
Yes, I can. Thank you very much. So coming to a topic that is similar to what Benedetta already mentioned, clinical trials are very important for medical innovation. and they have long overlooked menstrual health and people who menstruate, both in early and later phases of trials as well. As an example, based on studies in 2013 and 15, about 31% of participants in phase 1 trials were women. And this is where you figure out the drug mechanism and the interaction with the human body. So a very important step in the trial. There's another recent review that assessed standardization tools that measure menstrual health conditions for research. And this review said that of the 94 standardization tools, only 3 were robust enough for clinical trial use. Another historic but also very infamous example is in the US in the 70s, the thalidomide strategy. And this strategy created an enormous fear from the FDA, but also the EMA in the EU, of fetal harm if you include women in the development of trials, especially if they're of childbearing potential. So essentially what happened is that the drug was not properly tested for embryo interactions and ended up harming babies with severe deformities when born, and a lot of them also passing away in the first year. And this fear and bias still lingers until today. We also reviewed the official EU clinical trials register, showing that out of more than 44,000 registered trials, only 84 focus on endometriosis, 54 on PCOS, and only 16 on heavy menstrual bleeding. So of course, these are very little numbers and very niche topics, if you want to say, but very important and common conditions that have to be researched. And even if women are included in trials, their menstrual status is not recorded. It's rarely recorded. And the menstrual cycle and hormonal fluctuations are seen as confounding variables that make data interpretation difficult, even though this drug impacts the drug metabolism, the immune response, and symptom variability when testing out the drug.
Thank you so much, Anastasia. Such an important topic, also a bit disheartening, to be honest. But now let's move to a very concrete implication of menstrual health, which is the economic impact and period poverty. Martina, thank you.
Yes, indeed, we are moving into one of the most critical and concrete pillars of our manifesto. And I would like to start with a very hard reality, which is menstruation is a natural biological process, not a luxury choice. And yet, across the European Union, it is still heavily taxed and priced as if it was exactly a luxury item. And this is what scholars explicitly call a tax on female bodies. So the discriminatory nature of this tax becomes completely clear when you looked at how different European countries choose to categorize essential items and tampons and menstrual products, as you can see from the map. For example, in 2020, when I founded the No Tampon Tax Italia campaign to fight against this absurd system where menstrual products were taxed at the same high rates as luxury truffles or collectible stamps, the process that we went through was incredible. And it was really an illustration of the institutional instability surrounding this issue. In 2021, we successfully pushed to get the VAT on menstrual products lowered from 22% to 10%. And the following year, we brought it down to 5%, which was an incredible victory, which, however, was very short-lived because just the year after, it was brought back again to 10%. Until right now. And just a few weeks ago, new discussions have reopened to consider lowering it back to 5%. And of course, this constant fluctuating back and forth sends a very frustrating message because it shows that menstrual health is treated as if menstrual products were item for debate from year to year, depending entirely on which party is in power or who happens to be drafting the annual budget. But of course, menstrual equity cannot be an item for debate. It is a human right and fundamental right. And because of this lack of a harmonized and permanent approach, the financial burden across Europe remains highly unequal. Today, for instance, the VIT on these essential items still reach incredible high rates in Hungary, for instance, at 27%, in Sweden and in Denmark at 25%. And this, of course, creates a very devastating crisis, as it will be explained better later on a recent survey in 2025 by Opinionway Healthcare and Règles Élémentaires. 4 out of 10 people who menstruate in Europe are affected by period poverty. And of course, the trade-off are shocking. 34% of menstruating women have been forced to opt out of buying menstrual products due to financial reasons, and 13% have to decide between food and menstrual products only to afford them. And of course, when women cannot afford safe products, they miss school, they miss university, they miss work, and this leads to hidden socioeconomic disadvantages that, of course, impact over a lifetime. So throughout this manifesto, we, as the Young Women's Health Group, we are calling on EU policymakers to immediately eliminate the VAT on menstrual products using the flexibility granted in the 2022 EU VAT directive. And we also call to have free access to these products in all schools, universities, and public restrooms. But of course, there is a cruel paradox that stems from period poverty and leads into our next crucial discussion, which is when young women face severe financial strains. Often they are forced also to choose the cheapest, lowest quality menstrual products that are available. And this is where the economic injustice directly intersect with public health risks. And of course, true menstrual equity means that products are not only affordable and accessible, but also safe and transparently labeled. So this critical aspect, which is period product safety, will be discussed by our friends and colleagues at Règles Élémentaires. But before this, I will leave the floor to Noemi to conclude.
Thank you very much, Martina. What can I say more than all these recommendations that were already included in all the section that the team has just shown. We can go to the next slide. So it's time for EU policymakers on to act. And what should they do? We didn't write this manifesto for us. We didn't write this manifesto to just show that we recognize the problem and to talk about it as a self-help group. Is not that time anymore. This is not the time to understand. This is the time to ask and demand to policymakers a real action, finally, on menstrual health. For too long overview and for too long not understood. So my colleagues already explained it, like we want menstrual health to be recognized as a public health issue. We want finally to build menstrual health into EU, but also national systems, because we know that health is a priority for the member states, and VAT, for example, cannot be changed from a European level. We need to go to the member states. And in every political scenario, there is a change of VAT, as it is a change on gas prices, but VAT on menstrual products, as it is on gas prices, which is crazy. And we can already go to the other slide, because I think it goes a little bit deeper on what we really want from EU policymakers. So as Anastasia was mentioning, we need research, we need fundings, we need data. We are tired of looking for our own data through research of PhD students that have finally went to the rabbit hole on menstrual health and no, we need an observatory for menstrual health research and an observatory on people who menstruate and their health, their economic experience in life, and their dignified life. We need finally more inclusive data that are sex and gender disaggregated. There are so many goals right now in Europe that are addressing this issue, and it's time to finally address it. There is the European Institute of Women's Health that has been asking for a strategy on women's health, and this has to be done, this has to be delivered, because in a strategy like the one of the European Institute of Women's Health, we can finally also have a section on menstrual health and people who menstruate and go through all the needs that we need. We cannot survive on horizon projects anymore. We need to survive on a really priority inside real strategies. The European Union has just launched the gender equality strategy. Okay, let us see, where do you want to put it, the menstrual health issue. Also, there is DSW, who is calling for a dedicated moonshot for an instrument for fundings on women's health research and innovation. We know that only 6% of global research and innovation fundings are directed to women's health research, and only 1% covers female-specific condition, meaning that only 1% of these research innovation fundings are maybe somewhat on the menstrual health, so much less, because it is a female-specific condition among the many others. We need much more, and it's time to have a dedicated instrument, fundings, moonshot, mission, strategy, something on women's health. On women's health, and something that goes deeper on menstrual health. We were thinking of something like an observatory on menstrual health, because for us, the main problem was finding data to show you right now that this is a problem. I think the main data that we collected was that there is not enough data to even show if there is a problem or not. This is the main problem. We need data, we need indicators, we need specific indicators for health data. And also we need to advocate at the national level. We know that this is a EU menstrual health manifesto. Unfortunately, we still have to do our work inside our member states and bring this problem there and be completely annoying on that. Finally, it's time for free menstrual products, because as Justine will let you know much better than me, period poverty, as also Martina just said, is a barrier for education, is a barrier for work, is a barrier for a dignified life. So if we have free paper towels in every place we go, we should have free menstrual products. And then lastly, but not least, indeed, we need a clinical research that properly reflects on women's body. I literally yesterday just came across an amazing research from Poppy Cooper, which I think she's in the audience, talking about the relationship and the outcomes between COVID vaccine and different phases of menstrual health and menstrual cycle. So in a follicular phase, in a luteal phase, the outcomes were very different. We need to know these things. We cannot still not know the outcomes of a vaccine or a treatment, depending on our menstrual cycle. Okay, that said, and if I sparked for you a little bit of desire of demanding to policymakers the next steps, I will leave the floor to Justine, who has been a great advocate for both period poverty and period safety. So the floor is yours, and thank you so much for joining us.
Thank you, everybody. I would like to take a few seconds first to acknowledge all the work, and especially the volunteer work that has been put into this manifesto, and as too often it is volunteer. as too often on women's health, on gender equality, it comes from the heart and from all your free time, but it should be funded, and that's also why it should be made a priority so that advocates and specialists can keep the work. So I will introduce a bit of what we've been doing at Règles Élémentaires and also with a network of more than 30 partners across Europe. So first, to talk a bit about period poverty, I would like to focus on numbers and realities. Next slide, please. I don't know if I can. Yeah. So when it comes to period poverty, I'm sure lots of people here have definitions, right? But the thing is, like, there are several different kind of definition around period poverty. It of course includes like the fact to not have access to products, but it also having to choose between different kind of products, and it also includes not having like education or information about periods and about menstrual health, which will affect the ability to access products or to know how to choose for products. But beyond that, there are different kind of realities, and it's really important because Martina Rubino was saying it in introduction as well. Period poverty and period and menstrual health are first and foremost lived experience. Next slide, please. Yeah. So what I wanted to focus on about period poverty is first that it really affects different category of populations. When we look at it, so at Règles Élémentaires, we've been working with lots of people in France and Europe affected by period poverty, and what we observe is that it's more than 25, 30 categories of populations that are affected by period poverty. It goes from like single parent family to students to people who have to face economic barriers to lots of different categories of the population, and it's often quite unseen. It disproportionately affects people who are already marginalized, and it affects other dimensions of life, reinforcing exclusion, stigma, shame, and discrimination. So period poverty is really structural. And what I want to enhance here is that it is also reinforced in times of crisis. And as we know, we are experiencing a time of crisis, and therefore it should be treated as a full component of menstrual health and women's health, not as a side topic. Next slide, please. Yeah. Thank you. So today, I really want to highlight the great work of organizations that are specialized in period poverty in Europe. So we've been in touch with lots of them in the last year, but there are also like lots of other organizations who are leading this work. Like their work is really central, and so in order to tackle period poverty and address it on the EU level, we also need to keep working together. But what I wanted to say here is that it's usually this organization that produced the data. So as Noemi was saying, like there are no official data, there are no like guidelines on how to collect data, so it creates like a vast like diversity in data that are collected. Next slide, please. Yeah, so that's why when we look at it, for example, country by country, we can see that each countries have different data, and in some of them we will find that 10% people are experiencing period poverty, and in other 50%. And it's often because the definition is different and because the tool to measure are different. So that's why we launched the survey that Martina was talking about last year, because the idea was for us was really to see and analyze, like in the previous year, how many people have to choose between period products and something else, or had to not buy period products. And it was really striking. And unfortunately, what we are expecting is that it will increase. So as we know from like Eurostats as well, like there are 50 million women at risk of general poverty in the next year by 2028. So that's also why we really need to focus on this topic. Next slide, please. So today, in terms of like EU commitments, so it's quite encouraging that menstruations are referenced within the gender equality strategy, that there are like new initiatives around women's health. And like what is specifically mentioned is the organization of exchanges of best practice on menopause poverty and menstrual poverty, which is great because it's a great first step, but it is really insufficient for all the reasons we just evoked. So by advocating together, it should also push forward the fact that we need more than just one exchange of best practices, even though it's a first step. Next slide, please. So yeah, so for like the Young Women's Health Group has already lots of recommendation. We also have several recommendations that if there is a following up email, I can share with you specifically on period poverty. But what I really wanted to highlight on this aspect is that it should always be included because the access to menstrual health should be the same for everyone. Now, the other elements that I want to bring forward and that we've been working on for the last 5 years now is like the safety of period products. So next slide, please. So because today, so last year we asked people, like a representative number of EU citizens, what they thought about menstrual products transparency, and 83% of them said that they wanted to know the composition of menstrual products, but today there is no transparency and no mandatory elements that should appear on menstrual products labeling. So that's a real problem because next slide, please. Because what we have seen and analyzed today is that there are lots of toxic substances in menstrual products, and the research on that has been going on for 30 years. And during these 40 years, there were several like alarm bells that were rung to say, well, this is dangerous, this substance is dangerous, but it was never regulated on any level. So you have some countries, like for example in France, where intentionally added substances now have to be disclosed, but it's still not enough because it still doesn't take into account the full chain of manufacturing of period products and the levels in which the products are and could be dangerous. So menstrual products now are regulated under the General Product Safety Regulation, which means that they are regulated as like a razor or like any other product that is not in direct contact with mucosal tissue for several years. So it's really a problem because we don't have today any tool to address the fact that menstrual products are and can be dangerous, and there are also no evidences around the sources of contamination because there is no mandatory disclosure. We also can't tell, oh, the contamination happened where the first material was extracted, or the contamination happened during the chain of processes. So fortunately, there are people working on that, but we also need the EU to lead, because what we're seeing is that it can have an impact on like the endocrine system, on like reproductive health, on fertility, on lots of women's health and people who menstruate health. Next slide, please. Yeah. So how I would like to wrap up this to lead you the space for some question is really that we at Règles Élémentaires support completely the initiative around menstrual health here, and we hope to see much more data, of course, but also a stronger political will, because what we've seen recently is mostly experimental, which is necessary, which is really important, but we can't wait another 10 years for people to have access to products, for people to have access to specialists and doctors that understand them, and for people to have access to basic transparency on products they use daily. So thank you, everyone.
Thank you, Justine. This is really the work of people that have been working on it a lot. And we are very happy to continue following your work, especially also on the period product safety. That is something that only at the end we added in our manifesto, thanks to your work. So now it's time for the Q&A. I will open the chat.
Yeah, there are a lot of questions.
Perfect. Yes.
It's great. Thank you. And I'm also posting in the chat some questions that we received via the registration form. So,
yeah. So, one question is, how do you think we can move forward in addressing health and safety issue, especially given that different countries have varying regulation on toxic chemicals in menstrual products? Justine, I think this is for you.
Yeah. So we had so the REACH revision was planned. So it's currently postponed, but it's like an interesting tool to address safety issues. And then like you're talking about varying regulation on toxic chemicals depending on countries. So I think what we need is like a more defined frame on the EU level. So as I said, like now it's under the general safety frame. So either it could be through the creation of a special category or like having toxic substances in particular that are forbidden. So we know that there are more and more work around PFAS, for example. So it's one of the components that could be banned, but there are also like lots of talks happening about the fact that there is like lead and arsenic in tampons. So these are also substances that could be identified and banned. So yeah, there are several tools. I would say it's a long fight, but it's worth fighting.
Thank you, Justine. And I think this was very like a comprehensive answer, but I think, Justine, we can maybe give your contact if people have more question on period poverty and period product safety. Then, Martina, do you see other questions? I'm having problems with the chat.
yes, there is another question. What do you think? How can we overcome with this matter that is very common in Pakistan, that girls are thinking it is a sin to tell the man about the periods or menstrual health? How can we change the mindsets? I know that there are some girls in the group that have thoughts about this, so please feel free to
I think
answer.
it's a very sensitive topic, and I don't think any one of us has an expertise on that. But Evie, maybe you want to answer. And I just wanted to say that, yes, based on how the group is formed, right now maybe we cannot give a specific answer to that is sensitive and culture appropriate. Because we don't know that I don't have a specific answer for Pakistan, but Abby, if you have a better overview.
Just some thoughts, not necessarily specific to Pakistan, but to the concept of thinking that menstruation is a sin. Because it has a religious background, thinking that is a sin. Maybe if you could collaborate, not necessarily you as a person, but whoever organization would take this initiative could collaborate with more progressive religious leaders, that could help kind of bring the word to the people, that menstruation is okay and that it's not a sin in some way. And then, well, trying to establish this as knowledge with the people, you could start like exposure, and not hiding the pads, not trying to talk about, today I'm in pain because I'm on my period, making it casual and making it an everyday thing to talk about. But those were just my thoughts. It's not specific to Pakistan. I hope it helps in any way.
Yeah, thank you so much, Evie. And also, I really hope that we can all stay in contact and bring our conversation, all these conversations into different settings. We are absolutely willing to do so. So please feel free to reach out. Feel free to let's have multiple conversations in the next weeks and let's discuss all of this together. Also, there is a very difficult question, which is the critically important lack of data and how do we plan to address this in the future, which is something that we are really passionate about. And Monica, please reach out. I know that you're working on specifically in women in STEM, and we would love to expand on this conversation and to really understand how we can collaborate. So absolutely, thank you so much. And I also wanted to address a couple of questions that came from the registration form. The first one is reaching marginalized groups, so rural women, refugees, and people with disabilities, which is something that is always so incredibly difficult but also so important. And one thing that I wanted to highlight is that one size doesn't fit all in this case, because it's so important that, and money are never enough for this. For example, I do a lot of qualitative research to really understand the needs of marginalized people, but that's not always easy. It requires a lot of effort, a lot of infrastructures, and a lot of money, unfortunately. So I really wish that we are going toward a world in which asking marginalized people what they need is the norm, is not the exception. But in the meantime, there are different strategies that have been studied in the literature. So community-based approaches that are so important. So working with trusted local organizations, healthcare workers, community leaders, rather than top-down institutional channels. Also, something that frequently underestimated is adaptive materials, because something cannot be accessible if it's not in the language that one person speaks, and also a culturally relevant framing. So that's such an important conversation, and yeah, it's also strictly interconnected with the second one, which is integrating menstrual health into public health and education, especially in low resources settings. I know Martina had something to say about that.
Yeah, absolutely. I think the topic of, in general, sexual and affective education, which usually in the terminology is called comprehensive sexuality education, is specifically important because within it, menstrual education should fall. And in that sense, it's extremely important. And I will bring again a very personal example. I didn't know that the symptoms that I had were symptoms until I've been told so. I thought that heavy menstrual bleeding and debilitating period pain was just the normality. I've been told so by doctors, and that is not true. If you have extreme menstrual pain, that is not normal, and that should be taught to girls and people to spot early symptoms and avoid the development of diseases, for instance. Something that is not discussed enough because, again, menstruation is treated as a stigma, as a topic that should be not discussed. So definitely the first step that should be done is to integrate comprehensive sexuality education in schools that are adapted to the age of pupils and students in a way that even kids, because then we have precocious menstruation when girls are having their first period very early on. They don't know what they're going through because no one has explained that to them. So they don't only feel alone, but they also feel frustrated because they have no information on this. So it's extremely important that even within biology courses, we integrate information on menstruation as if we were talking about something completely normal, because it is actually normal. So definitely integrating this kind of curricula into the usual courses that we have in schools adapted to each age would be incredibly important. Again, not only to inform, but also to prevent the development of diseases. And if I can also add something else that Justine was mentioning, which is PFAS and relation to women's health. The member of the European Parliament, Cristina Guarda, is currently the Greens group is currently working on this very specific topic, and Cristina Guarda is working on women's health related to PFAS. It's unfortunately somehow just for Italians, but if you are Italian and you would like to participate, they are still looking for people to take part in this research project. So if you're interested, I will highly suggest to reach out to her or check her social media.
Thank you so much, Martina. We're a bit over time, and we apologize for that. I just wanted to acknowledge that also Edwin Koga is here, and they're doing amazing work on activism and performing arts, which should absolutely be recognized as it's really vital. So thank you so much for sharing that. And also there were a couple of questions on research questions for a master student right now, menstrual health. So please reach out because my master thesis was born from a conversation with Peggy. So we have so many research questions and please reach out and we can work together and do an amazing systematic review. So, okay. I think that we can wrap it up. Unfortunately, we would love to stay here and talk about that, but unfortunately, the time is a tyrant.
Thank you, Martina. Yes, let's wrap it up. Thank you, everybody, for coming. Just a quick reminder that you can still endorse the manifesto. You can even give us feedback. You can engage with us more informally, reaching out to the you find everything on the registration link and the LinkedIn Young Women's Health Group. You can also, at one point, we will have a call for recruiting new members of the Young Women's Health Group, so stay tuned. Probably will be after the summer months. If you want to participate, just as a reminder, it's a volunteer-based activity. And please share the manifesto with not only people that are interested or people that menstruate, but also outside of that, also to men, also to policymakers, because I know that many of us have also like a EU policy background. If you're a researcher, if you are a master's student, bring those topics outside. And if you're simply working in a workspace that has nothing to do with any of that, ask the question, do we have menstrual products in the bathroom or do we not? Thank you, everyone, for being here. Really, it has been a great journey, and we will keep the work up, and see you soon.
Thank you so much. This was great, really. We're so grateful. Thank you, and let's keep in touch.
Bye.
Bye, everyone. Bye-bye.